Good morning. Today's topic is to Introduction to Public Health. Learning outcomes. At the end of the lecture, students should be able to describe the different concepts and phases of public health, discuss the history of public health, and concepts of causation. Coming to health, if I ask you, are you healthy? You may interpret in different ways. But WHO has described health as a state of complete physical, mental, and social well being, and not merely an absence of disease or infirmity. In the last slide, we have discussed what is health, but as a community dentist, we have to know what is public health. If you are studying community, you are community dentist. If you are studying endodontics, you are endodontist. So general dentist is a person who knows everything about the dentist. So public health means the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort. This was given by Winslow in 1920. So we have already described what is health, what is public health. Now we are going to discuss what is dental public health. Dental public health is the science and art of preventing oral disease, prolonging life, and promoting health and efficiency through organized community effort and informed choices. Society, organization, public and private, individual and community. Given by Downer et al. In 1994. Coming to essential public health functions. For example, functions like protection of environment. Yes, public health or dental public health have a major role in protection of environment. Then health education. Then comes our health legislation and health regulations. Then prevention and control of communicable diseases, care for special groups as mothers, children, and workers in certain hazardous occupations. Then assessment of health needs, plans, and supports the provision of healthcare services to the population. So these are some of the functions of public health. As the heading states public, that means a group of people in a community. You have like a public health dentist or a public health professional has to take care of the public health. So he has to concentrate on the environment, because environment is also play a major fact. Once you go to general epidemiology, you will come to know what are the different factors affecting on the health. Like for example, environment, host, then agent. That's a triad. Then health education. Health education, why it's important means if you don't know proper brushing, definitely it may cause gingivitis or dental caries. So you should know, you should teach the people about the proper hygiene. So that is health education. Then comes our health legislation and health regulations. If you put I don't know whether Malaysia is practicing or not. If there is no regulation on pollution caused by vehicles, then environment will be polluted. So we have to impose some regulation on smoking, and that smoke which is exhaust from the vehicles. Then comes the prevention and control of communicable disease. That's what is going on. Like in COVID, how we are preventing? Wearing the mask, then social distancing. So we are preventing spreading of the disease. So that is nothing but prevention. Then comes the care for special groups. Yes, old age people are the children who are lesser than 5 years. They are essential groups. They need our care. Actually, some of the countries are planning to give free health care for those needy people, those who are children and adults who are more than 65 years old. Then assess the health needs. As a community dentist or a public health professional, we have to assess the need, what community wants. If, for example, if you do a survey, you come to know that in Butterworth, there are 65% of the people are having dental caries. So that is the need. So you have to assess and you have to report to the government. So these are the functions of public health. Then comes the community health or community medicine, is the application of principles of public health to communities. A community is a group of individuals sharing an identity, culture, and operates through common institutions and organizations. A health center in a rural or urban area is responsible for health of the community they serve within their catchment area. Coming to difference between community dentistry and clinical dentistry. We have classified based on the objective, information, investigation and diagnosis, resources, management and evaluation status. So in clinical dentistry, the objective is to patient cure, because patient will come to your clinic and you are going to treat them. But in community, you are going to the people for the improvement of people's health. In clinical dentistry, information given by the patient is like case history and related factors. But here you are going to calculate the morbidity and mortality. That means the disease rate and death rate. The investigation what are doing here in the clinical dentistry, you are doing laboratory tests and radiographs. But in community dentistry, you are doing surveys. The diagnosis, here the differential diagnosis you are giving, but in the community dentistry you are giving community diagnosis and priority settings. The resources in the clinical dentistry, it's available therapy, but in the community dentistry, it's the health and health related services. And coming to management, clinical dentistry, we are giving treatment. In community dentistry, we are giving health programs. So evaluation status is a follow-up of the patient. Here, assessment of the health. And these are some of the differences between clinical and community dentistry. Coming to history of public health. First phase, it's miasma theory of disease. Explained the spread of cholera in London and Paris. Death has believed to be caused by miasma, was considered to be poisonous vapor or mist filled with particles from the decomposed waste and matter. Disease has said to be preventable by basic hygiene. This was the beginning what we thought, like disease is caused by poisonous vapors or mist. Then comes the germ theory. This was given by Dr. John Snow and well-known epidemiologist during that time. He proposes that microorganisms are cause for the many diseases. The source of 1854 cholera epidemic in Soho in neighborhood of London was traced. Statistical analysis shows that drinking water was the main cause for transmission of the disease. Cases occurred in homes which was supplied by Broad Street pump at center of outbreak. So this is the picture showing Uh, the dots of the red color showing the number of cases in the city of Soho, but there is a common well somewhere here. So that is the responsible for spreading of disease. Yes, this is the pump from where the drinking water was supplied, and this was polluted. So the people who are consuming water from this pump are having disease. So that was the theory established at that time. If I ask you, for example, mm, diabetes, is it caused by germ? No, the cause for the diabetes is different. So our thinking proceeds. So we can't believe that every time germ is the causative factor for disease. So then they came and demanded from the people for clean water. At that time, the Thames was the both source of drinking and depository for sewage. The legislation was brought into force in England, the Public Health Act 1875 for the control of physical environments. Sir John Simon, the first medical officer of health in London, built up a city of public health in England which became admiration for the rest of the world. Early phase of public health was known as disease control phase, that is between 1880 and 1920. Then comes our second phase. The major person involved in is Edward Jenner. The theory of immunization. He inserted pus taken from the cowpox pustule into the incision on the boy's arm. Inoculated an 8-year-old boy with cowpox virus and subsequently observed that he has resistant and immune to smallpox. So he postulated some things like demonstrated that anthrax was caused by bacterium Bacillus anthracis, useful in determining and assessing the cause of the disease by microorganism. So that was the second phase. First one was environmental, that is cholera issue. Second is the bacterial disease spreading can be controlled by producing vaccine. Then comes the third one, the third phase. Third phase is shifted focus away from public health towards concentration of medical treatment and services delivered in hospital. This phase also saw the disappearance given towards infectious disease, which was addressed in 20th century in the beginning. Fourth phase, with growing awareness of the limitation of medical therapy to tackle the chronic disease and sparing the cost of healthcare. So, change in conception public health. This is very important. Many of the times we used to ask questions in this area. First phase is disease control phase. Public health during 19th century was largely a matter of sanitary legislation that we already discussed and sanitary reforms aimed at control of man's physical environment. For example, water supply, sewage disposal. Then these measures were not aimed at control of any specific disease. However, these measures vastly improved the health of the people due to disease and death control. Health promotion phase. At the beginning of 20th century, a new concept called health promotion began to shape. In addition to disease control activities, one more goal was added to public health, that is health promotion of individuals. It was initiated as a personal health services, school health services, industrial health, mental health, and rehabilitative services. Then comes the social engineering phase. With the advances, the pattern of disease began to change in developed world. A new health problem in the form of chronic disease, example cancer, diabetes, etc. A new concept of risk factors come to existence. This problem brought a new challenges to public health, and it entered into new phase in 1960 described social engineering phase. The social and behavioral aspects of disease and health were given new priority in this phase. Thus, the public health moved into preventive and rehabilitative aspects of chronic disease and behavioral problems. Then comes health for all phase. People in the developed countries and elite of developing countries enjoy all the determinants of good health: adequate income, nutrition, education, sanitation, safe drinking water, and comprehensive health care. In contrast, only 10 to 20% of the developing countries enjoy ready access to health service of any kind. Death claims 62 to 50 of every 1,000 live births within the first year of life, and life expectancy is 30% lower than in developed countries. Therefore, it was concluded that remaining 80% to have an equal claim to healthcare. In 1984, the members of World Health Organization pledged themselves an ambitious target to provide health for all by year 2020. So that is attainment of level of health that will permit all people to lead socially and economically productive life. Changing concepts of health. The first is biomedical, ecological second, is psychosocial, then holistic concept. Coming to biomedical concept. Has the basis in the germ theory of the disease, human body as a machine, disease as a consequence of the breakdown of the machine, and doctor's task is to repair the machine. Criticism has minimized the role of environment, social and psychosocial and cultural determinants, because these are some of the factors which affects health. Coming to ecological concepts, because we are in the previous slide I already said that environment factors they have not taken into consideration. So the ecological concepts came. Here, health is viewed as a dynamic equilibrium between man and his environment, and the disease a maladjustment of the human organism to environment. Then the person called Dubois defined the health saying, health implies the relative absence of pain and discomfort and continuous adaptation and adjustment to the environment to ensure optimal function. History argues strongly that improvement in human adaptation to natural environment can lead to longer life expectancies and better quality of life, even in the absence of modern health delivery services. This we have to agree. Then comes the psychosocial concepts. Health is not only a biomedical phenomenon, but one which is influenced by social, psychological, cultural, economic, and political factors of the people concerned. The good example is, for example, if there are two persons staying in a locality, one is a doctor and second one is a truck driver. Uh, for example, this doctor son is not studying well. Maybe the truck driver son is studying too good. So that time the peer pressure of the doctor is, I am a doctor, but still my son is not studying. So that is the social factor affecting the doctor. So these are some of the psychosocial concepts which will affect the health. So then comes the holistic concepts. In this, Synthesis of all the above concepts. So it involves to take the consideration of all the previous concepts, unified of multidimensional process involving the well-being of the whole person in the context of his environment. Implies all sectors of the society have an effect on health. Then the emphasis is on promotion and protection of health. Coming to concepts of causation. The first is epidemiological triad, natural history of disease, web of causation, risk factors and risk groups, multifactorial causation, then spectrum of disease, then iceberg of disease. Epidemiological triad. Here you can see agent, host, and environment. So environment part, agent part, and host part. When they have interaction here, this will lead to a particular kind of a disease. This is nothing but epidemiological triad. So all the three components play a major role to a disease. This is central part is disease. Like your intersectorial graph. Then the agent may be living or biological, or maybe non-living, like nutrients. Then the chemical, like internal urea ketone bodies, external temperature and pressure. Host, that is V, but for the population also you are classified into age, gender, ethnicity, then biological characteristics, genetics, physiological, biochemical characteristics, socioeconomic status, social class, lifestyle, living habits. Each and everything in this have its own role in health. Come to environment, the source of reservoir for the agents of disease. That is, both the agent and the host are staying in the environment. So this will also play a major role in deciding the health of the people. Helps in the transmission of the agents to the host, bringing about the contact and interaction, can be favorable and unfavorable to man environment. Two types, namely internal and external, like physical, solid liquid gas, biological, like virus. Then social. Coming to concepts of disease, a disease, a condition in which body health is impaired, a departure from state of health, and alteration of human body, interrupting the performance of vital functions is nothing but the disease. The natural history of disease. It's a model signifies the way in which a disease evolves over a time from period of its earliest stage to its termination as recovery or death. There are two phases. First is period of pre-pathogenesis phase. In this, the process is an environment. The disease agent has not yet entered the man, but the factors which favors its interaction with the human host are present in the environment. Second is period of pathogenesis. Here, the process in man begins with entry of the microorganism or agent, then disease agent into the human host, then outcome is recovery or disability or death. Anything can be happen. For example, if COVID virus has entered the human being, there may be chance of recovery also or disability also, like lung damage and death. So these are three uh, things which can lead from the virus. Then comes your web of causation. This was given by McMahon and Poe, and epidemiological principles and methods. In this, they ideally suited for chronic disease, that's interaction of multiple factors. Considering all predisposing factors of any type and their complex interrelationship with each other. Sometimes removal or elimination of just one link or chain is sufficient to control disease, provided that link is imported in pathologic or pathogenic process. For example, dental caries Poor oral hygiene is a cause for dental caries. Lack of knowledge is also cause. Malaligned teeth is also cause. Kerogenic microorganism is also cause, which is caused by diet. Then the age, elder age, there will be reduced saliva, so that is also a cause for dental caries. For example, if I give health education, I try to increase the knowledge, then the knowledge factor is neutral. So this factor may reduce the caries incidence. If I suggest them to not to have sugary food, so definitely there might be a reduction in dental caries incidence. So by altering the factors, the environmental factors, we can able to reduce the disease. And so that is nothing but web of causation of disease. Then comes to risk factors and risk group. An attribute or exposure that is significantly associated with the development of disease. A determinant that can be modified by intervention, thereby reducing the possibility of occurrence of disease or other specified outcomes. Risk groups are those who are exposed to the risk factors. For example, those people who are working in agricultural field, they're more prone for silicosis. Those who are working in cement factory, they are more prone for some lung disorders. So some of the risk factors and risk groups. Then comes our multifactorial causation. Pettenkofer of Munich is the first person to describe the multifactorial causation of disease. According to him, other factors in the etiology of disease like social, economic, cultural, genetic, and psychological are also equally important. Yes, definitely. Then comes, this is de-emphasize the concept of disease agent and stress on the multiplicity of interaction between host and environment. This is like holistic concept. Then comes our spectrum of disease. It is a graphic representation of variations in the manifestation of disease, the sequence of events that occur in the human host from the time of contact with the etiological agent up to the point of ultimate outcome. Extends from subclinical to fatal progression and can be halted by preventive measures. So this is iceberg phenomena. Whatever you can see, like the dentist or a doctor, this is it at the tip. Some hidden things which are inside the sea, this is what dentist or doctor has to explore. So whatever the doctor see, the case is reported to the hospital. But whatever we can't see, they will never come to the hospital. The hidden cases in the community with no symptoms or self-treatment are not reported or potential to spread. Okay, this we can diagnose only through community surveys or community approach. This is anyway their community clinics. So iceberg phenomena is a floating tip what physicians use in the community or clinical cases. Vast submerged portion, hidden mass of disease, latent or presymptomatic and undiagnosed carrier cases. Then the waterline which demarcate between the apparent and inapparent cases.